Hi, my name is Adriana. I'm going to be the nurse taking care of you today. Close the door for privacy. Today we're going to be doing a dressing wound change and droplet precaution. So I'm going to put on some PPE. First I'm going to put on the gown. Could you please tell me your name and date of birth?
My name's Anthony Saunders. I was born 4/4/93.
Okay. A little while ago we had given you some Tylenol for the pain. 0 to 10, what would you rate your pain now?
3.
Okay. And lastly, I would just put on some gloves. I would make sure that the patient is in a comfortable sitting position as well, and I would wash my hands before I put on my PPE. And I'm just going to gather my supplies. First, I'm going to put an absorbent pad just underneath the wound. Please lift your arm. Thank you. And then I'm also going to need measuring tape and cotton tip applicators. I'm going to take off the bandage. If the bandage were to stick, I would use saline to simply loosen the dressing. I would know any drainage on the dressing and then discard that. Next, I'm going to measure the wound and make sure I observe the appearance of the wound and the surrounding area. Let me grab this. So the length is 4 centimeters. The width is 3 centimeters. And with a cotton tip applicator, I will measure the depth by going into the middle and bringing my fingers down to where it meets its surface. So it's about 1 centimeter in depth. Discard that. Discard that. And then I'm going to take off my gloves, perform hand hygiene, and put on a new pair of gloves. I'm going to gather all my supplies on a clean surface, so I'm just going to lay down a towel to, this is my clean surface. Going to need 4x4, an ABD pad, stretch gauze, four cotton tip applicators, a suture removal kit, Lotiform or packaging, and some tape. So first I'm going to clean the wound with cotton tip applicators and a cleaning solution. I would start in the center and go from top to bottom. With a new applicator, I would go from one side, top to bottom. And with another new applicator, I would go from top to bottom on the opposite side. Next, I'm going to cut off a piece of the packaging. So I would take this and cut. And with a cotton tip applicator, I would gently push the Lotiform into the wound to pack it. Discard that. Next, I'm going to place a 4x4 gauze pad that's dry gently on top of the wound, and an ABD pad on top of that. Next, I'm going to use the stretch gauze and wrap this completely around. Sorry, thank you. Okay, and with a pen, I'm going to mark on the tape the time, the day, and my initials, and place that on to the wound dressing so we know what time and date it was last changed. Next, I'm going to discard these in the sharps container and get rid of my supplies. I'm going to remove the pad underneath. Remove my gloves first. My gown. And finally my mask. And then I'm going to perform hand hygiene, make sure that the patient is in comfortable and in the lowest position on the bed. And thank you.